Hi everybody, this is Dr. Howard Marshall of New York City, and we're going to continue where we left off from our earlier presentation on gum disease and periodontal disease. And this presentation will go into avoiding, diagnosing, and treating the gum diseases. So first, to avoid gum disease, we want to make sure that you're using proper brushing, flossing, and perhaps the use of an irrigator like the Waterpik. There are others. For people that don't floss regularly, Waterpiks have actually been found to be as useful in reducing the bacterial count. Now, in addition to what you do at home, getting a professional cleaning every 3 to 6 months is extremely important. If you do have periodontal disease, after treatment you're going to need to have a cleaning every 3 months. If you're younger and it's gingivitis, then having it every 6 months should be enough once you've reversed the gingivitis. What happens if tartar is not removed? Well, we're going to look at a few models so you have a very, very clear understanding. Let's look first at healthy gum again, and we see that it's pink and it completely occupies the space between the teeth. When it's irritated and inflamed, it gets reddish, and sometimes it actually recedes. And if we flip up this gum over to show what's happening underneath, we notice that the entire inner lining is inflamed, and where on this side we have normal gum, we see it lays over normal bone, and the normal bone is just 1/8 of an inch from the edge of the enamel, where the enamel ends and the root surface begins. In healthy gum, the very topmost fibers insert into the root surface, and then right beyond that, the fibers insert into the bone. In a disease situation where the patient has lost a lot of bone support, notice that the bone is way up here, and the root tips, the top of the tooth, is about here. So there's very little support left of bone around these teeth. On top of the roots, we see the byproducts of the inflamed gum line and gum surface, and we also see the deposits from the saliva and bacteria forming these heavy dark brown deposits, and that's the tartar or calculus that is underneath the gum, the inflamed diseased gum. And even if the gum is pink, sometimes there's still a lot of disease and bone loss underneath with this heavy tartar, and this can only be determined by x-rays and the use of a periodontal probe to take measurements on different sides of the tooth to see how deep the probe goes. Beyond 3 millimeters, you're in a disease range. Beyond 5 millimeters, for sure, you're having bone loss. In this particular case, the bone from normal heights, which would have been around this level, the bone is up so far that these teeth can no longer be saved. So this shows an advanced case, advanced to hopeless. So I hope that helps you understand what the progression is of the disease, going from a normal healthy pink to inflammation, to the need to get root planing and scaling, and then reprobe the pockets, and based on how much bone loss has occurred and what the anatomy of the bone is underneath and how much heavy tartar there is underneath, that determines what type of treatment will be needed. Why is it necessary to recheck your pockets a few weeks after the cleaning and hygiene instruction? It's very necessary to do this because you're going to get shrinkage of the inflamed tissue, and after 2 to 3 weeks you'll probably have shrunk as much as you're going to shrink from the inflammatory stage, and now you are left with a firmer, often dense gum tissue, and very often there may be bony defects under the gum tissue, and there still may be pockets in which bacteria are living that you don't want, the anaerobic bacteria. They live and love to live without oxygen. Now, to help you know the levels of your condition, the dentist diagnoses your gum condition, and to do this he uses a periodontal probe. We're going to show you that also in the visuals. Now, beside the visual examination of your tissue, which the dentist will look at, he's going to probe and chart. Charting means recording the current pocket depth of all the pockets around the teeth, or all the gum spaces around the teeth, so that a permanent record is created that can be compared to later in time. That becomes very important over the years, because sometimes people break down again, they regress, and you want to see where you were at the beginning. In addition, he's going to check for tooth looseness and record that. And if he's very sophisticated, some dentists actually will take bacterial cultures of the gingival fluid and find out what type of bacteria you have in the mouth that's causing your problem. This is not commonly done. Now, gingival fluid testing, which is related to bacterial cultures, we also want to consider the type of gingival fluid. If on probing, just touching the periodontal probe in the gum space, you bleed easily, then you know that the gum lining, and he knows or she knows, the dentist, that the gum lining is ulcerated and will need treatment to reverse it. Now, what is the significance of probing depth as a measurement of the severity of the disease? Well, normal readings would be up to 3 millimeters from the bottom of the gum space to the edge of the gum. When the readings are 4 to 5 millimeters, that's usually gingivitis, a breakdown of the fiber bundles of the gum, and is often reversible with root planing, instruction in oral hygiene, and demonstration by the patient that they can do the oral hygiene and will do it. Then it's reevaluated, as I discussed earlier, and reprobed to see if surgery and bone regeneration techniques are needed. So if you still have pockets after the first phase of root planing and good hygiene, then you're going to need the next step, which is the surgical treatment, unless you happen to be either somebody that has had surgery in the past and does not want to have it again, or has a history of breakdown over many years, in which case you may just have to have root planing every few months, or if you're elderly and are not a candidate for surgery. In general, I prefer pocket elimination surgery because I've seen the best results over the years on patients as I follow them. Now, if you have pockets over 5 to 9 millimeters, that often requires flap surgery and bone treatment, including recontouring, bone grafting. Today we can rebuild bone. And if the teeth are too far gone, extractions and socket grafting. And later that will permit placement of an implant. And sometimes we can actually extract and place the implant at the time of the extraction. Now, how we treat gum disease and bone loss depends on whether we're using a non-surgical approach or a surgical approach. Both have the same objective: elimination of pockets, reduction in harmful bacteria, elimination of inflammation, stopping loss of gum and bone structure, and regeneration of lost structure, particularly bone. Treatment in both cases is followed up with follow-up care, recall visits, re-education of hygiene techniques, and prevention of future disease. Now let's discuss the non-surgical treatment again. Instruction of brushing, instruction in flossing, use of the water pick or other irrigators. Scaling and root planing performed by either the dentist, the hygienist, or a periodontist. Then that can be accompanied at home with antibacterial irrigation, such as a water pick. Can also be used in the office with Paradex, also known as chlorhexidine, an antibacterial rinse. Then, after 2 to 3 weeks, reevaluation and monitoring using probing and x-rays.